Good day everyone! I am Fermil Pasgala from BSN 1-1 and I am going to be your nurse for today's return demonstration, and it's about intradermal injection. So before proceeding to your patient or doing the procedure, you should properly check for your doctor's order and for the patient's medication record in order for you to determine what are the materials that you are going to prepare and what are the solution or fluids that you are going to administer. So after doing those steps, you should now do your proper hand hygiene or hand washing. And after that, you may now proceed to your patient and do the rest of the procedure. So let's proceed. Okay, hello sir. I am Pramil and I am going to be your nurse for today. So, sir, can you state your name and your birthday? Okay. So, Mr. Frederick, you are scheduled for today's intradermal injection, and based on your medication record, I am going to give you a doctor's order, and that is a sterile water. So, do you have any concerns regarding with the procedure, or do you have any experience regarding the needles, or is it your first time? So, is it your first time? Okay. So, are you scared of the needles? Okay. So, sir, don't be afraid, and I can do the best that I can, and just sit back and relax. And I am the best nurse to perform a injection or intradermal injection. Okay. So, after verifying yourself with the patient and checking for the doctor's order, you may now give the patient a privacy and you may now proceed to your procedure. Okay? Sir, so can you, sir, move near me? Thank you. So your arm, sir. Okay. After doing those things, you may now wear your gloves and proceed to the steps that you are going to do. So, before cleaning the area of the injection site, you must first determine what area of the arm you are going to inject the solution. So as you can see, we have for intradermal injection, we have here the forearms. So you may use your 3 to 4 fingers with under the antecubital area, and this area is going to be the site of your injection, and you may now get your clean cotton ball with alcohol. Okay, and you may now clean the surface of the injection site. You may use the circular outward motion. Okay, so dispose that, and you may now use this syringe, and this is a tuberculin syringe. As you can see, it has the 1 cc or 1 ml syringe and a 25 gauge 5 to 8 inches needle. Okay, so get this as well as your doctor's order. So it is stated in the medication record that I am going to use a sterile water. In using solutions like this, you should check for the expiration date and for the information of the fluid or the solution. So in terms of vial, I have here a vial. When you are going to administer a vial fluid or solution, this is how it is going to be. So as you can see, I have here the tuberculin syringe. So when administering this vial solution, you should not use the needle that you are going to use for the patient in inserting or drawing a fluid from the vial. You need another needle in order for you to draw a fluid from the vial. So just like this, I'm going to demonstrate first. So you're going to inject another needle to the vial. Okay, just like that. And now you can remove the syringe out of the container. So there you go. So as you can see, it has its own needle, and this is the needle that you are going to use to your patient. So you're going to remove the needle just like that. Now we have only the syringe and we have here the needle. So you are going to place it, set it aside, and then you may now draw the fluid. But first before drawing the fluid out of the vial, you should aspirate from the expected ml or cc that you are going to inject to the patient. So I'm going to inject 0.3 cc. So I'm going to aspirate right here, and then I'm going to put it here, and then push it down, and then I'm going to draw the exact amount that I have aspirated. But for today, I'm not going to use a vial because it is stated on the medication record I am going to use a sterile water. So let us set this aside. And now let me put back the needle that I am going to use for the sterile water. So there we go. And then we are now going to need to open this sterile water. Just uncap the sterile water. Okay, and then dispose this. Okay. So after that, you may now get your syringe, your tuberculin syringe, and open the needle. Okay, so draw the expected ml or cc that you are going to inject to the patient. So I am going to draw 0.3 because that it is what stated on the medication record. And I am going to put it on the sterile water. Okay, so I am going to push down okay, so I am going to draw liquid, fluid, just right the amount that I have drawn. Okay, so just right that area. Okay, so after that, just get rid of the bubbles you have right over here. Okay, just write your eye level. So as you can see, I have here the tuberculin syringe with sterile water, and I have zoomed in the video in order for you to see the injection area. So I am going to clean again the area in a circular outward motion. This is the area. So I'm going to dispose this and let it dry. And then after that, you may now insert this fluid to the patient's skin. Okay, so with using my free hand, I'm going to stretch the patient's skin, the patient's area where I'm going to inject the fluid. So using a 5 to 15 degree angle, I am going to slowly insert the needle and insert the fluid to the patient's skin. Okay, so slowly take out the injection, and you are going to put this on the sharps bin and do not recap. Okay, so I am going to throw it away. And as you can see, it has a wheel. As you can see, it has a wheel right over there. You're going to need to encircle that area in order for you to determine what time and put a note or remarks in that area. So what I have said earlier, the wheel that you have created, you're going to encircle it and you're going to put a note or a remarks or time in order for you to determine what are the next step you are going to do. So encircle the wheel that you have created and put a time. So the time is, okay, so it is 11:30 p.m. Okay. So after that, do not put cotton balls or wet the area. Just let it be on what it is. Okay. So after that, you are now done and you may now document the procedure and you may now do the documentation. So thank you for watching. Good day everyone! Yes, I am the nurse that you have seen earlier on my video and I have done the intradermal injection to my patient and my patient was Mr. Frederick and as what I have said earlier, you should do a proper documentation regarding the procedure that you have done. So after doing the proper documentation that you have done, you should also properly dispose the materials that you have used, your gloves, the cotton balls, and especially the sharps or the needles that you have used, because in order for you to prevent contamination and injuries. Okay, so after the proper documentation, I have listed that I had inserted the doctor's order and that is the sterile water, and I had informed the patient on what are the possible outcomes regarding the will that was produced during the intradermal injection. So after doing those information and documentation, I now determine what are the things that you should do in the procedure of intradermal injection. So thank you for watching and I hope I had given a knowledgeable video to you. Thank you!